Hi, I'm Debbie Roman, and welcome to In the Know at Cummins. Joining me today is Tom Kixmiller, and he's a therapist here at Cummins. I'm sorry.
No, that's true. I am a therapist.
And we are going to talk about the therapy process today, so welcome, Tom.
Thank you.
Okay, so let's start off by asking, what is therapy?
Therapy is a broad idea. Therapy is really anything that helps someone recenter, reconnect, and heal. So when we're talking about mental health therapy and counseling therapy, it's a collaboration between a therapist and you to help you recenter, reconnect to yourself, and heal where things have gotten wounded, for lack of a better way of saying it.
Okay. So what will the first day of therapy look like?
It depends on if you're talking about the intake. So the first day of therapy is an intake, an assessment, and it's a full what's called a biopsychosocial. So we're looking at every part of someone's life to look at where maybe things got off track or aren't functioning well. And we're also looking at where things are functioning really well, because those are things we can build on to help someone recenter and heal.
Okay. So what is talked about in therapy?
When you're talking about the next kind of stage of therapy, that individual therapy or couples or family therapy, depending, that's where you start to build a relationship with your therapist, and it's kind of a friendship, but a different kind of friendship. You're not going to be hanging out outside of the therapy session or going shopping or sitting at the bar having a drink, but you're building a specific relationship to work on those pieces that aren't working and to help get you back to where you're functioning and you're more happy in your life and you feel good and confident and ready to take on the world.
So how long is a session?
We use, interestingly enough, Medicaid guidelines. They kind of give us the basis for timing of things, and they suggest that a therapy session is 38 to 52 minutes. And I know what you're thinking, well, it's an hour session, that's not an hour, I want my hour. There's good reason that those times are in there. Part of it is we as therapists, when we're building a relationship, there's some stress for us as well, because we care. So we need some of that time to think through things and sort that out. We also need that time to make sure that we're documenting everything. And by documentation, we have to do a note for every session. It helps us stay on track and remember what we're talking about and what we talked about last. And also helps give us a guide that we'll do with you in the session to look at what's working, what's not working, and where we need to go from that. So we need a little time to do that, because back to back to back to back to back, ooh, that's a lot in a day.
Yeah. So how long is someone expected to be in therapy?
It depends. There is no 100% guaranteed right or wrong set amount, unfortunately. Even within a particular mental health concern, there may be varying degrees of that disorder that someone's dealing with. So it could be one session. and I've seen that before. People have come in for one session and they just recalibrated something and that's all they needed. That's atypical, just so you know. Please don't expect us to work miracles in one session. But it can happen. There are some disorders that take years or even decades to work on. It just really depends on how ready someone is for the change process, how invested they are in the change process, and what they're dealing with.
Okay, so what kinds of therapies do we offer?
We're a community mental health center, and we offer a full range of services. So starting from age 5 all the way up to as old as you can get, we have individual counseling, we have couples counseling, family counseling, so that's working on how the family does or doesn't work together or fit together. We can do combinations of those as well. We also have some pretty specific addictions counseling services, so that's all the way from individual services on up to what's an intensive outpatient therapy group, which is 9 hours a week of intensive services to really address kind of the systemic way, the full body, full life way substances invade and throw things off track. So along with that therapy, we also have services to go along with that to sometimes speed up that process so it's not, years. So that's life skills specialists, which I believe are discussed other places, work on skills with people. We have psychiatric services here that also help coordinate between physical and mental health. So I think all that's covered elsewhere.
Okay, great. So what are some of the misconceptions of therapy?
I'm going to fix you. It's gonna come in and there's a medication to fix everything. It's going to be awful all the time. It's terrifying. And some of those, are based on things that people have heard. Some of those are based on stigma, overall negative beliefs about what mental health is. I think the biggest misconception is you're going to come in and I'm going to do something to you to fix it. And that's not really how that works. We're going to work together. Human beings are self-healing as long as someone can help guide them in getting the things out of the way that are blocked, and that's really what therapists do. We don't do therapy to you, we do therapy with you.
That's great. So what advice would you give someone who is hesitant about coming in for services?
It is okay to be terrified and take care of yourself anyway. I've been in therapy before, I've been in services myself, and it's scary. It's scary to think of opening up about those things, it's scary to think of sharing those with another human being. It's scary to even think about sitting down and looking at them in a focused way. And that's okay. You're not alone. Pretty much everybody's scared initially to come to therapy services. So, it's about getting dedicated to you and realizing it's okay to be scared and to take care of yourself.
Okay, great. Well, thank you so much for joining me today,
You're
Tom.
welcome.
And if you have any questions or want any information or any more information about these services or any services that we offer here at Cummins Behavioral Health, just give us a call at 888-714-1927 or check us out on the web at cumminsbhs.org. Thank you.